Welcome. Today, we'll answer some very interesting questions about progesterone. Let's start with the first question.
What is progesterone?
Progesterone is a natural female hormone produced by the corpus luteum in the ovary after ovulation and later by the placenta during pregnancy. Its main role is to prepare the lining of the uterus, the endometrium, to receive a fertilized egg. You can think of it as the guardian of pregnancy, because it helps the uterine lining thicken, become soft and rich in blood vessels, creating the perfect environment for implantation. In addition, progesterone relaxes the muscles of the uterus, prevents premature contractions, and lowers immune activity so the body doesn't reject the embryo. In natural cycles, progesterone rises after ovulation and drops if no fertilization occurs, which triggers menstruation. In IVF, hormone stimulation can disrupt this natural balance, so progesterone supplementation becomes essential.
And why is progesterone important in IVF?
Progesterone is the cornerstone of the luteal phase, the second half of the cycle after ovulation or egg retrieval. During IVF stimulation, the natural hormonal signals that tell the ovaries to produce progesterone are often suppressed. Without enough progesterone, the endometrium cannot mature properly, and even a perfect embryo cannot implant. Simply put, progesterone is the glue that connects the embryo to the uterus. It transforms the endometrium from a growing phase into a receptive phase, making implantation and early pregnancy possible.
When is progesterone started in IVF?
In a standard IVF protocol, progesterone supplementation begins the day after egg retrieval. This mimics the time when the corpus luteum would naturally start producing it. In frozen embryo transfer (FET) cycles, progesterone is started 3 to 5 days before the embryo transfer, depending on the embryo's age. For example, 5 days before if a day 5 blastocyst will be transferred. This precise timing ensures the uterus and the embryo are synchronized, what doctors call the implantation window.
How long is progesterone used after transfer?
Usually until the 10th to 12th week of pregnancy, because only then does the placenta start producing enough progesterone on its own. During early pregnancy, the embryo and uterus are entirely dependent on external progesterone. If the medication is stopped too early, hormone levels can drop and threaten the pregnancy. Once the placenta matures, the supplement is tapered off gradually. In women with previous miscarriages or luteal phase problems, doctors sometimes continue it until week 16.
And what is the natural role of progesterone in the menstrual cycle?
During the first half of the cycle, estrogen stimulates the uterine lining to grow. After ovulation, progesterone takes over, halting growth and converting the lining into a nutrient-rich bed ready for implantation. It also slightly raises body temperature, calms uterine contractions, and prepares the breasts for possible pregnancy. If no fertilization occurs, progesterone levels drop, the lining sheds, and menstruation begins. In short, progesterone acts as the body's natural switch from fertile to pregnant mode.
So, who decides the progesterone dosage in IVF?
Only a fertility specialist can determine the correct dose. There is no universal rule. It depends on many factors: the type of IVF cycle, fresh or frozen, the woman's hormone levels, age, body weight, and past IVF outcomes. Some women respond well to standard vaginal doses, while others need a combination of vaginal and injectable progesterone to maintain optimal levels. The goal is not to reach the highest possible level, but a stable one that keeps the endometrium receptive.
Is progesterone used in every IVF cycle?
Yes, absolutely. It's a universal part of modern IVF treatment. Regardless of whether it's a stimulated, frozen, or natural cycle, every patient receives some form of luteal phase progesterone support. Even women who ovulate naturally may have insufficient luteal function after ovarian stimulation. Therefore, progesterone is given preventively in all IVF cycles to ensure hormonal stability.
What forms of progesterone are available?
There are several forms. Vaginal capsules or gel, applied directly to the vagina for local absorption. Intramuscular injections, given deep into the muscle for a steady release into the bloodstream. Oral tablets, less commonly used because they are less efficiently absorbed and can cause drowsiness. Vaginal forms are the most popular since they deliver high concentrations to the uterus with minimal side effects.
And which form is most effective?
Studies show that both vaginal and injectable progesterone are equally effective when used correctly. Vaginal progesterone acts locally, right where it's needed, while injections ensure more stable blood levels. Women who have had several failed implantations or show low serum progesterone may benefit from combining both forms. Ultimately, the best option depends on each patient's comfort, hormone levels, and doctor's recommendation.
Can different forms be combined?
Yes, and in many clinics this is common. For example, a woman might use vaginal capsules daily and receive an injection every few days. This dual approach is helpful for women who've had repeated implantation failures, low progesterone levels, or poor luteal response. It offers extra hormonal stability during those critical first 2 weeks after transfer.
How does progesterone affect the endometrium?
Progesterone transforms the uterine lining from a simple growing tissue into a complex, nutrient-rich structure ready to host an embryo. This process, called secretory transformation, makes the endometrium thick, soft, and full of tiny glands that secrete proteins and sugars, the embryo's first food. Progesterone also relaxes the uterus, reduces contractions, and creates a calm, immune-tolerant environment. Without this transformation, implantation simply cannot occur, no matter how good the embryo is.
What does luteal support mean?
Luteal support refers to hormonal treatment, usually with progesterone, during the second half of the cycle. It compensates for the natural luteal phase deficiency that often occurs after ovarian stimulation in IVF. Even in natural cycles, the luteal phase lasts about 14 days. In stimulated cycles, it's often shorter or weaker. By adding progesterone externally, doctors ensure that the uterine lining remains stable and receptive long enough for the embryo to implant and develop.
Does progesterone affect embryo quality?
Not directly. The quality of an embryo is determined by its genetics and development in the lab. Progesterone does not change that. What it does affect is the environment in which the embryo lands. A receptive, well-supported endometrium dramatically increases the chance that a healthy embryo will successfully attach. So while progesterone doesn't improve the embryo itself, it gives it the best possible chance to survive.
Can progesterone prevent menstruation?
Yes, and that's actually its natural job. As long as progesterone levels remain high, the body doesn't receive the hormonal signal to shed the uterine lining. When levels drop sharply, the lining breaks down and menstruation begins. In IVF cycles, as long as you're using progesterone, your period usually won't come, even if pregnancy doesn't occur, until the medication is stopped. This is completely normal and not harmful. Once the supplement is discontinued, bleeding typically starts within a few days.
What happens if progesterone suddenly drops?
A sudden fall in progesterone can trigger uterine contractions and bleeding. In early pregnancy, this can lead to miscarriage. Progesterone keeps the uterus quiet, preventing it from contracting, and maintains the attachment between the embryo and the uterine wall. That's why stopping the medication abruptly is never safe. When discontinuing progesterone, doctors always taper the dose gradually over days or weeks, ensuring that the placenta has fully taken over hormone production.
Is progesterone application painful?
Vaginal forms are painless and very easy to use. typically inserted once or twice daily with an applicator. They act locally and are well tolerated. Injections, on the other hand, can be uncomfortable because they are given deep into the muscle. The site can feel sore, red, or firm. Rotating sides, gently warming the ampule, and massaging the area afterward can reduce pain. Although injections are effective, most women prefer vaginal forms because they are more convenient and equally reliable.
When is the best time to take progesterone?
The most important thing is consistency. Take it at the same time every day to maintain stable hormone levels. For vaginal capsules, spacing doses evenly, for example, every 12 hours, is best. Many women prefer taking them before bed, which minimizes leakage and allows better absorption. For injections, your doctor will usually set a fixed daily time, such as every morning, to keep hormone levels steady throughout the day.
And what if I forget a dose?
Don't panic. Progesterone stays in your tissues for several hours, so missing one dose rarely causes harm. If you remember within a few hours, take it right away. If it's close to the next dose, skip the missed one and continue normally. Never double the dose to catch up. If you forget repeatedly or go more than 24 hours without it, inform your clinic. Your doctor may adjust your schedule or check blood levels to ensure the endometrium remains supported.
Can I use progesterone by myself at home?
Yes, most women do. Vaginal forms are self-administered and simple to use. Clean hands and a calm routine are enough. For injections, it's recommended that a nurse or trained partner helps, at least at first, until the technique feels comfortable. It's important to use sterile needles, alternate injection sites, and follow the doctor's guidance carefully. Self-administration gives many patients a sense of independence and control, but dosing should never be changed without medical advice.
Can progesterone affect my mood?
Yes, slightly. Progesterone acts on the brain as well as the uterus. In the nervous system, it converts into a calming substance called allopregnanolone, which has sedative-like effects. Some women feel more relaxed or sleepy, while others report mood swings or mild irritability. These effects are temporary and usually fade within days after stopping the medication. It's important to know this is not depression. It's your brain adapting to pregnancy-level hormones. A bit of self-care and rest usually helps a lot.
What are the most common side effects of progesterone?
Most side effects are mild and short-lived. They include bloating, breast tenderness, drowsiness, mild headaches, or pelvic heaviness. Vaginal products can cause a white or yellow discharge. That's normal residue, not infection. Injection sites can feel sore, red, or form small lumps if the same spot is used repeatedly. These can be minimized with warm compresses and alternating sides. Serious side effects are very rare. Overall, progesterone is one of the safest medications used in reproductive medicine.
Does progesterone cause weight gain?
Not true weight gain. It doesn't increase fat or appetite. However, it can cause temporary water retention, leading to a feeling of puffiness or mild swelling. This is hormonal and completely reversible. Once treatment ends, your body naturally releases the extra fluid. Progesterone levels in pregnancy are high for months, so it's normal for the body to respond with slight changes in water balance and digestion.
Can progesterone cause nausea?
Yes, in a small number of women. Progesterone can slow digestion, which sometimes leads to nausea, bloating, or loss of appetite. These symptoms usually appear in the first few days of treatment and fade as the body adjusts. Taking the dose at night or after a light meal often helps. If nausea persists, your doctor may switch you to vaginal progesterone, which bypasses the stomach and nearly always solves the problem.
Do side effects differ between forms?
Absolutely. Vaginal progesterone has the fewest systemic side effects since it acts locally. It may cause minor discharge, but rarely anything else. Injections are effective but can be painful and cause skin irritation or small nodules. Oral progesterone may cause drowsiness or dizziness because it circulates through the brain. For most IVF patients, the vaginal route offers the best balance of comfort and efficacy. Hence, it's considered the gold standard form today.
Is light bleeding normal even while taking progesterone?
Yes, it can be. Light spotting around the time of implantation, often called implantation bleeding, can happen even in successful pregnancies. It's typically brief, pale pink or brown, and not a sign of failure. However, if the bleeding becomes heavier or is accompanied by cramps, your doctor will check hormone levels and possibly increase the progesterone dose. Many women panic at the first sign of bleeding, but in IVF, it's not always bad news. Sometimes it's a sign the embryo is settling in.
How is progesterone measured in the blood?
Progesterone levels are checked through a simple blood test. It's usually performed about 5 to 7 days after ovulation, or just before embryo transfer in a programmed cycle. The result helps the doctor confirm that ovulation occurred and that the corpus luteum, or supplementation, is producing enough hormone. While routine checks aren't always needed, measuring levels can be very helpful in women with previous implantation failures or suspected luteal insufficiency.
And what is considered a normal progesterone level in the luteal phase?
Normal varies depending on the lab, but typically anything above 10 nanograms per milliliter indicates a healthy luteal phase. During pregnancy or after embryo transfer, doctors often aim for higher levels, around 15 to 20 nanograms per milliliter, to ensure optimal support for the endometrium. It's not just the number that matters, but stability. Progesterone that remains consistently adequate throughout the 2-week wait is key.
Is regular progesterone monitoring necessary during treatment?
Not for everyone. Most women respond well without constant testing. However, in special situations, repeated failed cycles, heavy bleeding, or unusual symptoms, your clinic might measure progesterone to decide whether to increase the dose or add injections. Too frequent testing can also create unnecessary stress. What matters most is consistent, correct use of the medication.
Does low progesterone mean IVF will fail?
Not necessarily. Low levels can be corrected quickly by adjusting the dose or combining forms. Implantation depends on many factors: embryo quality, timing, uterine health. So progesterone is only one piece of the puzzle. What's important is detecting a deficiency early and treating it before implantation occurs.
Is progesterone measured again after transfer?
Sometimes, yes. Some clinics routinely check levels about a week after embryo transfer, while others only test if symptoms suggest a problem. If the level is lower than expected, your doctor may increase the dose or add injections. Monitoring can provide reassurance that hormonal conditions remain ideal during the critical early days of pregnancy.
Why is progesterone continued even after a positive pregnancy test?
Because during the first 8 to 10 weeks, the developing placenta is not yet producing enough progesterone on its own. The early pregnancy is entirely dependent on the external supply. Stopping too soon can lead to a dangerous drop in hormone levels and risk miscarriage. Once the placenta matures, usually around week 10, it becomes the main source of progesterone, and the supplementation can safely be tapered off.
When does the placenta take over progesterone production?
Around the 9th to 10th week of pregnancy. At this point, the placenta becomes fully functional and releases sufficient hormones to maintain the pregnancy. Doctors often confirm this transition by ultrasound, showing a healthy embryo with a strong heartbeat and a well-developed placenta.
What happens if progesterone is stopped too early?
Stopping progesterone abruptly before the placenta takes over can cause a sudden hormone drop, leading to uterine contractions or bleeding. In early pregnancy, this can endanger the embryo or result in loss. That's why doctors carefully plan the tapering process, decreasing the dose slowly over 1 to 2 weeks while monitoring for any warning signs.
How is progesterone gradually discontinued?
Typically, the dose is reduced step by step. For example, from twice daily to once daily, then every other day, over 1 or 2 weeks. This gives the placenta time to fully assume hormone production without sudden hormonal changes. If at any point spotting or pain occurs, the doctor may extend progesterone support a bit longer for safety.
So, how can doctors tell if the placenta is functioning properly?
Through ultrasound and sometimes blood tests. A healthy, growing embryo, stable endometrial thickness, and proper blood flow are signs that the placenta is doing its job. When these markers are clear, doctors can confidently reduce progesterone without risk to the pregnancy.
What if I don't tolerate progesterone well?
Some women experience irritation, excessive discharge, or local discomfort from certain brands or forms. In that case, your doctor can switch you to another formulation or route of administration. There are many options available today, so almost every patient can find a version that works comfortably.
Do women in natural FET cycles also receive progesterone?
Yes, though usually for a shorter time. If a woman ovulates naturally, her body already produces some progesterone. But supplementation adds stability and ensures the timing is perfect for embryo transfer. Even in natural cycles, a small hormonal boost can make a difference in implantation success.
Is additional medication needed with progesterone?
Sometimes, yes. Depending on individual history, doctors may combine progesterone with estrogen, low-dose aspirin, or blood thinners, such as heparin. This approach is personalized, based on past miscarriages, blood clotting issues, or immune factors. The goal is always the same: to create the safest, most supportive environment for the embryo.
Does progesterone affect pregnancy test results?
No. Progesterone does not interfere with the accuracy of a beta-HCG test. Pregnancy tests measure HCG, a hormone produced only by the embryo, so progesterone supplementation will not cause a false positive or negative.
So, is progesterone used in donor egg cycles?
Yes, in fact, it's essential. In donor egg IVF, the recipient woman does not ovulate, so she produces no natural progesterone. All the hormonal support must therefore come from medication to make the uterus ready for the transferred embryo.
Does progesterone increase implantation chances for everyone?
Progesterone doesn't boost chances beyond what nature allows, but it's a prerequisite. Without it, implantation cannot happen at all. So while it's not a magic enhancer, it is absolutely essential for success.
Are natural and synthetic progesterone the same?
Micronized natural progesterone, the kind used in IVF, is chemically identical to the hormone your body makes. Synthetic progestins, sometimes used in birth control pills, have slightly different structures and are not used for IVF support because they act differently on uterine tissue.
Can progesterone be taken without a prescription?
No. Because dosing and timing are critical, it should always be prescribed by a fertility specialist. Improper use can disrupt your natural cycle and make treatment more difficult later.
Is it normal for progesterone capsules to vary in color or smell?
Yes. Differences in color, texture, or odor come from the manufacturer's inactive ingredients, not the hormone itself. All approved products have equivalent hormonal strength and safety.
Can you have too much progesterone?
It's rare, but excessive levels can cause fatigue, constipation, or dizziness. Because the hormone accumulates in tissues, your doctor will tailor the dose carefully. More isn't always better. Balance is what matters most.
How do I know if the treatment is working?
If you're not bleeding and your pregnancy test is positive, it's working. Early signs, such as tender breasts, mild fatigue, or emotional sensitivity, also suggest that progesterone is active. Your doctor can confirm success through ultrasound once the embryo implants.
Should I stop progesterone if I get my period?
Only after confirming a negative beta-HCG test. Sometimes light bleeding occurs even in early pregnancy, so stopping too soon could endanger an ongoing pregnancy. Always consult your doctor before making any changes.
What should I do if I experience side effects?
Never stop on your own. Report any unusual symptoms to your clinic. Most side effects are manageable by switching brands, changing the route from injection to vaginal, or adjusting timing. The benefits of progesterone for embryo support far outweigh temporary discomfort.
How do women usually feel during progesterone therapy?
Many describe feeling calmer, slightly sleepy, or emotionally sensitive, similar to early pregnancy. These sensations are normal and fade once treatment ends. Recognizing them as part of the hormonal process helps reduce anxiety and builds confidence during the 2-week wait.
What's the main takeaway about progesterone?
Progesterone is the quiet protector of early pregnancy. It doesn't make miracles happen, but without it, miracles can't begin. By stabilizing the uterine environment, preventing contractions, and nurturing implantation, it gives every embryo the chance to grow into life. When used correctly and consistently, it's one of the most important allies in IVF treatment.
And that's all for today. For more information about the IVF process, visit ivf4me.com.